Hi, my name is Sunil Rama, and I'm a chiropractor based in Dublin. And today I'm going to be giving a quick talk about ankylosing spondylitis. Now, ankylosing spondylitis is a condition which we see more prominent in males. We've got about a 3:1 more male prevalence. And these patients usually complain about pain and stiffness in their lower back over their lumbosacral area. And it's sort of worse in the morning upon getting out of bed. Patients usually experience quite a bit of pain at night when they're turning over. Those patients can also experience a bit of stiffness over the rib cage, over the midsection of the spine, and sometimes at a later stage it starts affecting the neck where they start having a range of motion that becomes fairly restricted. When we usually assess these patients, we would rely on x-rays, and they have a typical bamboo spine where the entire architecture of the vertebra are fairly straight and solid, and they formed a sort of a contiguous type of structure. And we also see inflammation taking place at the lowest pelvic joints, what we call the sacroiliac joints, which is a very common source of pain. But these patients usually start getting more and more stiff, and the ability to flex all the way forward becomes more restrictive and limiting as the aging process goes on. In most patients, we start finding the tightness that it develops over their breathing techniques, where they get a bit of pain in the front part of the chest and the midsection of the spine. And usually, there's a family history that the patient does present with pain, where they had a mom or dad with similar symptoms. And we see usually patients responding very well to mobilization techniques such as swimming, physiotherapy, and chiropractic care. Some of the signs that we look for when the patient presents to the practice is limitation of movement, and they usually do have other conditions where there may be a hand involvement, where a finger starts getting swollen and stiff, or a knee starts getting swollen and stiff. We usually find them having a bit of tightness over the calf muscles, over the Achilles area that's closest to the heel, and some of them do complain about plantar fasciitis. A few patients also complain about redness in the eyes. In those patients, we've got to treat them more systemically, where we run a panel of blood tests, what we call the CRP, ESR, and the famous HLA-B27. And those patients usually code positive about 90% of the time for ankylosing spondylitis, especially when they start having these symptoms. So when we're going to be X-raying these patients, those are the findings we're going to be having. And on lab work, we look for those blood tests. Now, not all patients have positive markers on bloods, and which will just monitor these patients. When they do have flare-ups, they may respond well to care, and sometimes they may benefit from anti-inflammatory medication. Sometimes just your normal topical analgesics tend to help. And for a certain class of patients, they may respond better to cortisone therapy and other drugs where they have sort of TNF inhibitors. Those are usually prescribed by the consultant. So, what we want to do when we see these patients is reduce their pain, improve their mobility, but at the same time be very mindful of flare ups, because those patients do tend to get worse with the more exercise they tend to do. They usually get pain at rest day as well, but certain aggressive exercises can worsen their pain. And the trick with these type of patients is you want to try and improve mobility, reduce any smoking, because that's a very common cause for worsening patient symptoms. And of course, dietary change by avoiding certain acidic foods are usually contributing factors as well.